So what we're doing at FitTrace is we're taking body composition measurement data so we can optimize fitness, health, and performance. So really we take just a scan of your body in order to really achieve the maximum goals from nutrition and performance programs. So usually you have to go to like a trainer, they maybe do some measurements on you and they do some performance stuff, and you do a survey and figure out, all right, what are your goals? How can we get you there? We can do all of that with one scan. And really it's decades of work that I've been doing in the research side to get to this level, and there's a lot of good information available to researchers and the scientific community that the public isn't getting access to. So we're bridging that gap and being really the main educators and facilitators for bringing this detailed information about your body and helping you get to the next level of your fitness, health, and even preventative disease and athletic performance. So that's kind of our scope of everything that we're kind of working on.
How would I get access to this? How would I be able to do it?
So right now we're working with a machine that uses x-rays. It's called DEXA. And it's a medical device. It's been around for about 25 years or so. And I've been actually doing research in it. In my PhD, did a lot of research in it. But I've been doing research in it for 15 plus years. And we have a ton of data on it. I mean, there's NIH studies, even global data in different countries and stuff using this technology. So we have a lot of information about this device that can provide us detailed information about medical issues as well as performance. So if you want to get a scan, there's a lot of facilities now that are popping up because the device is a lot more easily available or ready to use, more so in the last few years. So there's actually a facility, there was one down the street from here, but a lot of colleges and a lot of universities also have these machines. So the machine is pretty expensive, but it's a medical grade machine. It can tell you how much fat you have in your right forearm.
I have no fat.
Or how much muscle you have in your right leg compared to your left leg, or your upper body, your upper right arm versus your lower left. You can really do all these comparisons. We have over 100 measurements from a single 10-minute scan. So it's becoming a lot more available to the general public as well as athletes. But there's a gap in what do we do with this information? And that's what FitTrace does. We tell you what to do with that information and make it user-friendly so you can understand what those 100 variables mean and how your goals and your scan relate and how you can optimize a program to get you to the goals that you want to achieve. Does that make sense?
It makes total sense. I just remember being in the gym and this 18-year-old kid saying, "Let me measure you," and taking
the old skin fold calipers.
Yeah, it's so terrifying. And then doing all these things and then printing a report out, and I was like, this kid didn't even go to college yet,
right.
And I'm basing my health journey and my decisions on this little printout.
Right. And his interpretation of
it. And I just felt like, I don't know. I'm not so sure. So it feels like you're really meeting a need.
Yeah, and so there's this big gap, but the need is there's the lack of confidence, right? And there's a lack of available devices or methods to really empower somebody to utilize that information to make informed decisions, right? So like with you, you're like, I don't really know, like how much confidence do you have in doing the program because of that experience? So we're taking medical level information and using research studies from the past several decades, quantifying that all together and saying, look, if you do this, your body will change this way and that'll reduce these metabolic conditions or improve your athletic performance. If you're a running back or a volleyball player or an endurance athlete, we know exactly where the fat should be, where the muscle should be, and how much of it you should have. And depending on your goals, we can actually tell you how to get there. Versus, a 19-year-old kid who just learned how to do calipers. So we're the authority in that, and we're growing, and it's a really fun and exciting thing. To me, being a scientist, it's years and years of the work and watching it not get to the general public and getting frustrated with it, and then partnering with my CEO and building this company. I'm being able to disseminate the stuff that I've been doing in the lab that people don't pick up a medical journal and interpret it and apply it to their life. I'm doing that with this company in FitTrace. That's what FitTrace is doing. So it's really exciting
So
and fun.
exciting. Thank you for joining me.
Thank you.
Thank you for explaining
I
this.
think I probably talked too much. You didn't have
No, you were
any questions.
fantastic. I loved it.